So query from number 100 from Satra, Maharashtra. Bargaining regarding charges, suggestions in the line of treatment, demand for guarantee, demands of line of treatment as per the Google, how to recover dues of treatment charges. So simply saying, bargaining happens when we don't detail the things, you can say, good enough or in a strong enough manner to the patient at the start, and at the end these will keep on happening. So set the expectations right in terms of bargaining, in terms of treatment charges, in terms of suggestions or whatever, and of course the guarantee warranty thing also. You may pass on the lab warranty of the prosthesis, but with the terms and conditions rider. Again, that is a thing for discussion for another day. How do I do it? I have a video on that also, so you can follow that. But I don't give warranty guarantee for any procedures. But yes, I do pass on the lab processes, whatever I get from the lab, I pass it on, but with a set of written terms and conditions from my side, what is applicable in that. I make it absolutely clear. If the tooth below the process is breaks with the because of lack of care, the warranty and guarantee is not going to come handy. And I don't mention it verbally, I mention it in the written part. And one copy is with me and one copy is with the patient. So that thing is to be there. So if the patient is a googling patient, as you know, is wanting treatment on demands of the same line, then you need to set the expectations right in the first place. As I said, you need to mention those things clearly. Who is the in charge, who decides the treatment plan, and if the patient is still hell-bent on comparing you to Google and wanting you to follow that, happily say a no, refuse the patient. You can refuse any patient before the start, but once you take up the case, you are in a legal foundation to complete that patient, even if the patient does not pay you. The law mandates no fee, no cure is not acceptable. We fall under the Indian contract law 1872, which should go away soon, but that law mandates us to complete the treatment when started. So be very cautious of the treatment to be started first. How to recover dues of treatment charges? Try politely, try in a way. If you don't have any documentation, nothing of the legal ways is going to work. So we follow the system of the consent form. We mentioned the treatment charge in the consent form only, and in the treatment estimate form, which is a 3-in-1 form for us. We use it for three purposes: as a journal history form, as a treatment approval form, and as a treatment estimate form. So it has a 3-in-1 function. Only a few, I can say, lines need to be changed at the bottom and at the top heading, and it becomes a 3-in-1 form for us. This is the way we have designed it. So I've shared that multiple times in the group itself. So uh, and that makes sure if the patient has signed at, you can say, at 2 or 3 places, they are bound to pay that. And yes, you make sure you give them the treatment estimates as well, treatment payment breakdown as well, so that the patient, when they have received the broken payment schedule, they are actually very, very sure about it, that how much to pay, how to pay, when to pay. So, and finish your treatment charges by second or third last sitting. So you won't face any of this problem in that regard. So it is again about detailing everything at the start. If you detail everything, you will have lesser and lesser amount of problems. So I hope I have answered your query.